Now, looking at a different matter, there are reports of a virus called the respiratory syncytial virus circulating around the country. The Department of Health and the National Institute for Communicable Diseases says there is no need for the public to panic. Right, let's expand on this. Former SAMA chair and primary healthcare physician, Dr. Angelique Coetzee, joins us now for a discussion. Dr. Coetzee, a very good evening to you. Thank you so much for your time. We've been told not to panic, but given what history has shown us, the impact of COVID-19, the pandemic, one can't really help but feel a certain level of discomfort. How should one interpret such a call?
So, yes, Paul, thank you for having me here, and a good evening to all your listeners and viewers out there. So we need to understand that if you look between COVID and the flu the flu that's currently going around, or the previous stats of the flu, the death rate or the mortality rate of COVID is much higher than flu. But at the current stage, we don't see an uptake in COVID-19. It is unfortunately also true that if you suffer from viral disease and it feels like flu, we need to make sure whether it is indeed flu, whether it's COVID, whether it's RSV virus that's going around, and then Bordetella pertussis or whooping cough. And please don't forget the normal cold virus, rhinovirus, that's also going around. Mm-hmm. So what we are seeing, however, is the current flu clinical picture of the patient is, yes, they come in, they don't feel well, those body aches and pain, malaise, what we call that, with a bit of a fever, but it's the cough. We see them as having sort of a very dry, irritable cough, which, again, we try to test each and every one for COVID, because, as it is very similar to COVID. But we don't see an surge in COVID at this stage. And the influenza virus that's going around is type A, H1N1, commonly known as swine flu for the people out there. That's the main influenza virus going around currently.
So we learned from as early as January that a cocktail of respiratory viruses had hit a number of the European countries with high levels of flu, and this, of course, was circulating amid low vaccination rates. How different is South African, the South African population, given the example of what's happening across the European countries?
A very good question. So there's still what we see vaccine hesitation around with our people in South Africa, especially around the flu virus or the flu vaccines. In our surgery this year, we haven't even ordered flu vaccines, as most of the patients will go to the pharmacy. But I haven't, again, heard from the patients that they are, really going and get themselves vaccinated, especially older patients with immune diseases or low immune systems, and then the children. So if we look at some of the stats that the CDC released in March, according to them, the vaccines that's currently available, what they have seen is that it is effective in preventing flu-related hospitalization between 41 to 44% in adults and around about 52 to 61% for kids. Mm-hmm. So yes, there is a reduction in hospitalization if you take the vaccines. You will also have a reduced doctor visits. But also I need to stress that by now you should have taken your flu vaccine. It takes around about 2 weeks before it starts to protect you, and then it can protect you for anything from 6 to 12 months. And because we are on the southern hemisphere, you are right, we will know what happens in the northern hemisphere, and our vaccines will then be tailor-made from what they have experienced during the winter in the northern hemisphere.
You speak about the flu shot being one preventative measure. What other measures should people be taking during this time?
So I think it's very important, but there's two ways that you need to look at this. So first of all, if you are suffering from anything that you think is a cold or a flu or any of the respiratory viruses going around, you as a person, as the patient, needs to make sure that you rather stay at home. You know, your incubation period before you start with symptoms is around about 1 to 4 days. That's the one thing that you need to know. And then it takes you about 1 to 10 days to really recover. So if you then go to work and you're feeling ill, you run the risk of actually spreading it in your offices, because most of the people are back into offices, open space offices. So you've got actually a responsibility towards yourself to go to bed. You know, if you feel very, very under the weather, you can go and see your doctor. If we can see you within 72 hours after you started with symptoms, we can always also prescribe oseltamivir to try to help to reduce your symptoms. That's one thing. And then the normal, you know, water, good hydration, chicken soup, stuff like paracetamol or any of those for the body aches and pains, and just stay in bed. So that's what you're actually supposed to do. However, if I am a family member of someone who has the flu or a respiratory tract infection going around, for me, I need to make sure that, you know, if that patient or that person coughs, that at least either I protect myself with a mask, that I wash my hands regularly, that there's good ventilation so that the virus doesn't stay in the room. It's very similar to what we saw with COVID-19, the normal precautionary measurements that we advised during that time. So yes, there's two obligations, and then again, you know, you should have been vaccinated by now to protect you if you are pregnant. I need to stress that pregnant ladies, as well as breastfeeding ladies, they can take the flu vaccine. So, and even if you're pregnant and you take the flu vaccine, it will at least, protect your baby afterwards for at least 6 months. The baby will get the additional immunity from you that you have incurred with taking the vaccine.
Very well. Thank you so much for that very sound advice there, Dr. Angelique Coetzee, expanding, of course, on the respiratory virus that we're seeing across the country.